In the heart of winter 2022, James Smith, a man in his prime, sought urgent medical attention, bearing the symptoms of disorientation, abnormal vital signs, and a fever that refused to subside. And shivering in the cold grip of winter, James Smith, a man at the peak of his life, found himself in a battle against a mysterious ailment. World was spinning, his body was rebelling, and a fever was blazing within him, a fever that no home remedy or over-the-counter medicine could quell. Desperate for relief, Smith made his way to the Zanderit Health Center, hoping to find answers and a solution to his distress. He walked through those doors, trusting the institution, putting his life in the hands of professionals who were supposed to guide him towards recovery. Physicians there took note of Smith's symptoms, the disorientation, the abnormal vital signs, the relentless fever. They saw the signs, but they failed to connect the dots. Despite a negative flu test, they concluded it was nothing more than a severe case of influenza. A misdiagnosis that would come to haunt Smith and change his life in ways no one could have foreseen. Sent him home, armed with nothing more than a prescription of Tamiflu, a medication meant to combat the flu virus. Smith, trusting in their expertise, took the medication, hoping for a respite from his suffering, none the wiser about the true enemy that was wreaking havoc within his body. Each passing day, as Smith swallowed the Tamiflu, the real culprit, bacterial meningitis, was left unchecked, allowed to spread and ravage his body further. But Smith didn't know. He couldn't have known. He was led to believe it was just the flu, a common ailment that would pass with time and rest. Little did Smith know the true menace within his body was far more sinister than the flu, and this misdiagnosis would alter the course of his life forever. Days later, James Smith's health spiraled downwards, his condition deteriorating to alarming levels. An ominous cloud of uncertainty loomed over him as his body waged a relentless war against an unseen enemy. It wasn't the flu, as initially diagnosed. It was something far more sinister, something that had slipped through the cracks of the initial diagnosis. James Smith's body was being ravaged by bacterial meningitis, a disease that, if caught early, could have been treated. But time, the most precious commodity in James Smith's battle, had been squandered. The disease, unchecked and unchallenged, had spread its venomous tendrils, wreaking havoc within James Smith's body. In an attempt to halt the disease's destructive march, doctors at the Midwest Health Center induced a coma. It was a desperate move, a race against time, a bid to buy precious moments in the face of an enemy that refused to relent. But the damage was done. The disease had already reached James Smith's brain, leaving a trail of devastation in its wake. James Smith suffered strokes, robbing him of his motor functions, his ability to perform the most mundane tasks we often take for granted. The bacterial meningitis, relentless in its assault, attacked James Smith's auditory nerves, rendering him permanently deaf. Imagine one day, the world around you is filled with the symphony of life, and the next you are plunged into an eerie silence with no hope of ever hearing again. The disease didn't stop at James Smith's hearing. It gnawed at his nerves, leaving him with nerve damage that would affect him for the rest of his life. And the worst was yet to come. The bacterial meningitis, having run its destructive course, left James Smith with brain damage. The man who walked into the Midwest Health Center with fever, disorientation, and abnormal vital signs was no longer the same. He was now a shell of his former self, trapped within the confines of his damaged body and mind. The delayed diagnosis of meningitis had already set in motion a series of irreversible damages. This was the grim reality James Smith was forced to confront, a painful testament to the devastating consequences of medical misdiagnosis. Armed with resilience and the pursuit of justice, James Smith decided to challenge the Zanderit Health Center in court. A legal battle ensued, where the magnitude of the case hinged on 4 essential criteria for medical malpractice. Firstly, there was the professional duty that the center owed Smith, a duty that demanded accurate diagnosis and appropriate care. This was established by the very nature of Smith's visit to the center, seeking help for his alarming symptoms. However, a breach of this duty occurred when the Zanderit Health Center misdiagnosed Smith's condition. Despite a negative flu test, they diagnosed him with the flu and sent him home with Tamiflu. This failure to correctly identify Smith's condition, despite the presence of clear and severe symptoms, constituted a gross negligence of their professional duty. The third criterion, injury, was indisputably met. Smith suffered severe and life-altering injuries as a result of this misdiagnosis. He faced an induced coma, multiple strokes, permanent hearing loss, nerve damage and brain damage. These were not minor injuries, but rather they were catastrophic consequences that dramatically altered the course of Smith's life. Then there were the damages. The court awarded Smith a staggering $27 million, acknowledging the extent of his past and future suffering, as well as the loss of both body and mind function. This wasn't just about the financial loss Smith faced due to his inability to work or the medical bills that piled up. It was about the immense pain and suffering he endured and will continue to endure for the rest of his life. The Zanderit Health Center's breach of duty had a profound impact, one that Smith will never escape from. This legal battle underscores the severe consequences of medical malpractice, serving as a stark reminder of the lasting impact a single misstep in healthcare can inflict. The hammer of justice fell heavily on the Zanderit Health Center, marking a turning point in Smith's life. The jury's verdict reverberated through the courtroom. James Smith was awarded an astounding $27 million in damages. This monumental sum, one of the most substantial ever awarded in a medical malpractice case, mirrors the severity of Smith's injuries. Permanent deafness, nerve and brain trauma, and the lasting torment of strokes are repercussions that cannot be overlooked. This case echoed throughout the medical profession, a stark reminder of the gravity a single diagnosis can possess. It highlights the necessity of thoroughness, carefulness, and the need to maintain the highest standards of care. Smith's trial emphasizes the deep-seated impact of medical malpractice, a glaring warning of the enduring consequences a solitary error in healthcare can inflict. It serves as an alarm bell, imploring medical practitioners to sustain vigilance and diligence in their responsibility of care. While no sum of money can truly make amends for Smith's suffering, this verdict stands as a clear warning to the medical industry. The price of an error can be crushingly high.